Welcome back to the Dr. Jeffrey Tauth Heart Talk Show, and today's show is called Dr. Jeffrey Tauth, Your Cough Could Be Heart Failure. And trust me, it's juicier than your cousin's peach cobbler. You've been treating that persistent cough with cough drops and rest, but what if I told you it could be your heart desperately trying to tell you something? Yep, entirely true. I can't make this stuff up, folks. Let me blow your mind for a second. There's something called cardiac asthma. And here's the kicker, it's not asthma at all. It's your heart throwing a tantrum because it can't keep up with the workload. When your heart starts failing, fluid backs up into your lungs like a clogged drain in your kitchen sink. And what happens? You start coughing, wheezing, and gasping for air just like someone with regular asthma. The problem is, this looks exactly like respiratory issues. So what do people do? They grab their inhaler, pop some cough medicine, maybe see their family doctor who prescribes breathing treatments. Meanwhile, their heart is sitting there like that friend trying to get your attention at a loud party, waving frantically while you're completely oblivious. Here's where it gets really interesting. When your heart can't pump blood efficiently, and I'm talking about when it's weaker than a wet paper towel, that blood has nowhere to go. So it backs up into your lung vessels like traffic on I-95 during rush hour. This creates the exact same breathing problems as asthma, but we're treating the wrong organ entirely. Now, Dr. Jeffrey Tauth is about to give you the secret sauce that separates cardiac asthma from the regular kind. Ready for this? Cardiac asthma gets worse when you lie flat. It's like your lungs are saying, oh no, not the horizontal position again. That's because gravity isn't helping drain that backed up fluid anymore. And here's another dead giveaway. It happens at night. Your regular asthma doesn't care what time it is, but cardiac asthma, it's got a schedule, and that schedule is usually around 2 or 3 in the morning when you're trying to sleep. Let me tell you about Margaret. This 67-year-old grandmother spent 6 months, 6 entire months, using inhalers for what 3 different doctors thought was adult-onset asthma. She's puffing away on these breathing treatments like her life depends on it. But here's what made me suspicious when she finally landed in my office. Her asthma attacks happened every single night around 2 a.m. like clockwork. This poor woman hadn't slept lying down in months. She's propped up in a recliner every night because that's the only way she could breathe. Her family thought she was just getting older, maybe a little dramatic. But when we did her heart tests, guess what we found? Her heart was only pumping at 30% capacity. 30%? That's like trying to water your garden with a straw. Margaret didn't have asthma, her heart was failing, and those breathing problems were her lungs drowning in fluid. Once we treated her heart failure, those nighttime asthma attacks disappeared faster than free donuts at a police convention. So how do you know if your cough is actually your heart calling for help? Here are the red flags that should have you running, not walking, to a cardiologist. First, swollen ankles. If your ankles look like they belong on the Michelin Man, that's fluid retention, and that's your heart struggling to keep up. Second, you're exhausted all the time. I'm not talking about I stayed up too late watching Netflix tired. I'm talking about I can't walk to my mailbox without feeling like I ran a marathon exhausted. Third, and this one's really important, if you're coughing up pink or frothy sputum, that's not a cold, my friend. That's fluid from your lungs and you need help immediately. Maybe I should see you in the clinic. We need to talk. And remember that nighttime pattern. If your breathing problems consistently get worse when you lie down or wake you up in the middle of the night, your heart might be staging a protest. Here's your actionable takeaway, and I want you to write this down. If your persistent cough comes with the nighttime breathing problems, ankle swelling, or extreme fatigue, skip the cough medicine aisle at the pharmacy. Don't waste time with more inhalers. Get yourself to a cardiologist immediately because your heart might be crying for help, and time is not your friend when it comes to heart failure. Your heart doesn't whisper, it shouts through symptoms. The question is, are you listening? This has been the Dr. Jeffrey Tauth Heart Talk Show. Until next time, stay healthy. And remember, if you're looking for answers, check out drjeffreytauth.us.com. Later, y'all.